All right. So doping, it says use of prohibited substances or methods for performance enhancement. That's doping. But according to the WADA Code 2021, as we discussed, there are 11 other things which are included in anti-doping rule violation. We will be discussing about that. So I think there is some screen sharing. Give me one quick moment. I think. All right. According to the World Anti-Doping Code 2021, till 2015, education was not the primary motto, but now it has been included. So it has become testing and investigations, prohibited list, therapeutic use exemptions, laboratories, and protection of privacy and personal information. Along with that, education is also one of the important things in 2021, because everybody needs to know what is doping. Instead of, it's always said that prevention is better than cure, because if you have been there, if you've been there, like if you're caught with the anti-doping rule violation, so instead of that, if you know what is anti-doping rule violation, what is the violation is all about, you will definitely would not go ahead and land up into that kind of trouble. So we're going to discuss about that today. Now, anti-doping program in India is done by Ministry of Youth Affairs and Sports. Now, there are two departments in that. One is NADA, one is NDTL. NADA is National Anti-Doping Agency, which does the test planning, sample collection, result management, and education of the entire program. Now, the other one is National Dope Testing Laboratory, which does the sample testing, research, and education about the program. Now, we'll discuss about those 11 things which actually is counted in anti-doping rule violation, where the first thing comes as presence. It says presence of a prohibited substance or its metabolites or markers in an athlete sample. So now, how this is considered? It's basically testing positive for a substance that is prohibited or is in prohibited list. If presence of that comes up, or if there is something, we test for presence of substances and drugs, basically, which are there in prohibited list. If, or there are markers also, in case we figure out that any kind of test markers have been exceeded or something, that would be considered in presence of any kind of prohibited substance in the sample of the athlete. Now, it's each athlete's personal responsibility to ensure that no prohibited substance enter his or her body. That means it's not like, it's basically the athlete's responsibility. It's not that you can't say that somebody has informed me or somebody has asked me to take this, I have done that, and it's their mistake, not my mistake. It won't be counted that way. In athletes, it's your personal responsibility, athlete's personal responsibility. If anything being tested into his body, that is his or her own responsibility. Now, any kind of prohibited sample found in your in athlete's urine or blood, that is athlete's responsibility. Now, what happens is a positive test is, it's basically what happens is sometimes we feel like somebody has informed us that, okay, go ahead and take these kind of supplements, and I did that. And tomorrow, if I get positive, I tested positive, I go ahead and I say, it's not my mistake. It was the doctor who actually prescribed me, or the doctor who has done this for me. In case, if you have to take any kind of prohibited substance or medication, you need to use the TUE, that is therapeutic use exemption forms, that we are going to discuss about in further slides also, what is TUE all about. Now, the second is use. It's basically, second is use. Now, what is use all about here? It says using or trying to use banned substances. This includes athlete biological passport cases. Now, it's basically what happens is sometimes in presence, you actually use it and the entire substance is there in It's been found into your urine or blood sample. But in use, what comes is that means you have taken the prohibited substance, but it was not somehow it didn't get you didn't get tested positive for some reason. But we have got ample of evidence that there are people, those who say that he has taken the substance, and if we got an ample of witnesses, or if we see that there is ample of things, we can figure out that somebody is there and they say that he has taken these kind of medication, and we know about that he has taken it, but somehow it was not found in his sample. So or if there would be any kind of documentary evidence against the person, that is also is considered under anti-doping rule violation. So you need to be very careful. It's not only the presence, but in case enough evidence is there regarding somebody witnesses it that you have taken these kind of medication or these kind of methods you have used, and there is documentary evidence for that, or ample of data or analytic information is there, definitely it would be considered under anti-doping rule violation. Now, next comes evasion. Evasion is evading something where it's refusing or failing to submit a sample collection. It's basically hiding from a dope control officer or refusing to take the test. When you go to the dope control station, you refuse there that I don't want that somebody should witness me or somebody should come down and witness me. I will give the sample, but I'm not ready to. I'm not ready for any kind of instance where somebody has to witness me while passing the urine. It's if that kind of things comes in, that also comes under anti-doping rule violation. Now, hiding from dope control officer, I just wanted to give you an example. There was an instance where as soon as what happens is, as soon as athlete gets selected for if we say that so and so athlete, we have to go ahead and conduct a dope control test for that athlete. Now, DC of the doping control officer tries to go ahead and go to the field and tries to approaches the athlete. Now, what happens is, as soon as athlete sees the doping control officer approaching him or her, he or she tries to run away from there or hide from that place. Now, that is also considered as anti-doping rule violation. So the basic thing is, what you need to do is, you need to, as soon as you see that a dope control officer, if he's going ahead, if he's approaching you, just wait, listen to him, what he's going to explain you. He will explain you that you have been selected for a dope test. So he will show you his iCard or his authority, and you have to show your ID proof. It can be your identification proof. He would go ahead and fill up the form. He will write down your name, your entire the ID which you have mentioned. He will go ahead and he'll write down the ID number, your date of birth, your name and everything, and he will ask you to sign the document. That's the part of notification where you have been notified. So please understand this. This is for in case you go ahead and you hide, or after signing up the notification form, or before that, if you try to run away from the field, that is also considered as anti-doping rule violation. So then you have some time of 60 minutes that you have to, he will accompany you till the dope control station, and you have that 60 minutes time where you can go and he will accompany you. You go to the dope control station. That 60-minute time, it has got things like where you should not have any, that too, in case you don't have any kind of media commitment, in case you do not have any kind of medal ceremony, in case you don't have to warm down or cool down session, in case you don't have any kind of things like that, you need to, then the 60-minute period is not counted. Then immediately you need to, he will accompany you, you need to go to the dope control station. But in case you have these kind of commitments, then he will give you, or in case you want to get your ID, or in case you want to, you want an interpreter, or if you have some language barrier and you want to get an interpreter, or that kind of things, then 60 minutes are used. Otherwise, immediately you have to reach the dope control station. Failing which, it leads to anti-doping rule violation. So very, very important. Then comes whereabout failures. Now, what is whereabout failure? It's basically for registered testing pool athletes, where it says athlete not being where they say they will be, missing the test during their 60-minute time slot, not submitting or submitting incomplete or wrong information. It is potential anti-doping rule violation. If there are 3 whereabout failures in 12 months period, it is considered as the entire anti-doping rule violation. So what is this is all about? Basically out of competition people, where they have got we have got registered testing pool people, athletes, where we have to go and test them. Anytime you are there in the registered testing pool, you have to upload your whereabouts. That means where you have to from 24 hours, you have to select a slot for 60 minutes that I would be available. I will be available at this point during this time within this 60 minutes. That means from if you give the time from 11 to 12 noon. So you will say I would be during this time, I would be at my practice session. You have to fill in the complete address details, which practice session, where, which field, which place, everything you have to mention. And you have to update that in case you are not available there, in case doping control officer reaches that place and you are not available there, that means definitely that would be considered as one of the ADRVs. So 3 whereabout failures in 12 months. That means in 1 year, if 3 whereabout failures are there, it would be considered as anti-doping rule violation. So you need to be very careful about this also. Then comes tampering. Now tampering comes, that is interfering with testing or dope control process. Now, what happens is, as I explained you in the previous topic also, where we were talking about evasion, hiding from dope control officer. Tampering also comes in once you are there in the DCS, that means dope control station. And you reach the dope control station, and now you want to, you take the collection vessel for urine sample. Now you take the vessel, and as you know, you people might have given a doping test. So every time when you give the sample, it has to be witnessed by a DCO. Now, in case you go ahead and you start interfering with the process, no, I don't want to. I don't want that somebody should witness me. I'll go ahead and I'll give the sample, but I don't want somebody to witness me. Definitely, in case that is the problem, then that's not possible, because witnessing is important. Now, in case these kind of interferences are there, then it would be considered as anti-doping rule violation. Now, sometimes what happens is dope control officer explains you, this is the procedure, this is how you have to go about. These are the this is a sample collection kit. So you go ahead and you choose one. You say, I'm not going to choose it. I don't want these sample kits. I want a different kind of sample kits. That is also that also comes into interfering. Sometimes what happens is dope control officer, but sometimes intentionally, athlete, what he does is he collects the sample and then he breaks the sample collection bottle. If he throws the urine, or he does these kind of things, any kind of interfering in testing would lead to anti-doping rule violation. Then comes possession. Now, it's the word itself, possession, says having banned substance or method in your possession without an exemption, that is therapeutic use exemption, or justifiable reason. Now, the thing is, we from National Anti-Doping Agency, we are tied up. Yes. Hello.
I think, Mr. Narendra, you can continue. There was, I think, someone by mistake must have unmuted themselves.
Not a problem.
Yeah.
All right. So the next is possession. Possession is having banned substances or methods in your possession without an exemption, or without any TUE or any justifiable reason, in case you have been found with any kind of possession of prohibited drug or method with you, then it would be considered as one of the anti-doping rule violations. Now, National Anti-Doping Agency has got, we have tied up with, we are in touch with a lot of law enforcement agencies, that is nationally and internationally. So we keep on getting updates that these kind of things are there, and if we figure out that somebody has got, if we get this kind of tip where we can come to know that somebody is using, or they are actually they have this kind of banned substance without any kind of TU in their bag, in their pocket, if that kind of thing happens, then also it will be considered as anti-doping rule violation. Next comes trafficking. It's basically the same kind of thing, but this is something where it's considered as handling on transport or transporting, selling or attempting to sell banned substances to athletes. These kind of things, and if these kind of things happen, definitely it would be considered as anti-doping rule violation. As I already explained you, that we are in touch with law enforcement agencies in India as well as internationally. So we keep on getting updates about these things. So in case you are found trafficking these kind of handling or transporting or selling these kind of banned substances, it would be considered as anti-doping rule violation. Then comes administration to an athlete. Sometimes what happens is that we say that we haven't taken any kind of prohibited substance, but we found to be administrating that same substance to an athlete. That means in case if somebody wants to, they have an injectable, like an injection, and they want that, I cannot inject myself, can you help me? And you go ahead and you help him or her. That is, and you, if that's been found, then also it's anti-doping rule violation. Administration to an athlete is an anti-doping rule violation. You need to be very careful. It says giving or trying to give a banned substance to an athlete is considered as anti-doping rule violation. Next comes complicity, that is helping someone or dope or helping someone to cover up doping. And this what happens is where sometimes if you help someone in doping or cover up doping, that is also considered as anti-doping rule violation. That means it can include like assisting someone or encouraging someone, aiding, abetting, or conspiring to help someone, or conspire any kind of conspiracy you are trying to do, that kind of thing. That comes in complicity. Or covering up someone. That means if somebody is taking, you know that this person is taking prohibited substances, but you're trying to cover him up or her up. That is also one of the anti-doping rule violations. You need to be very careful about that. Then comes prohibited association. Now, prohibited association is athletes, like some kind of coaches or some athletes. Those are already been barred. Those have been sanctioned for 4 years, 8 years. If you try to seek help from them, like any kind of help, any kind of services, any kind of methods of, or you're trying to learn some kind of methods from them, that is also considered under anti-doping rule violation. So it says working with or seeking help or services from someone who is serving a period of ineligibility. Those who have already been sanctioned. So if you go to the WADA's website, you will find athlete sports personals list, coaches list who has been banned or been sanctioned. So you can check from those lists if that person or athlete is given, he's serving a period of ineligibility. Please understand that if you are his friend or her friend, you need to be away from the person, because that is, if you have been found or been caught helping or seeking services from them, then it would be considered as anti-doping rule violation. Then comes discourage or retaliate. Now, discourage or retaliate comes from the thing where by any reason, an athlete, if somebody has complained about, suppose there is an athlete A and athlete B. if athlete B goes ahead and complains about athlete A about his doping thing, and athlete A goes ahead and threatens athlete B, stating that in case you go ahead trying to threaten him or trying to take revenge from athlete B, that would be considered under anti-doping rule violation. So you cannot go ahead and threaten someone in case your name has been taken by someone. In case that's, you cannot threaten someone, you cannot go ahead and say that I'm going to take revenge. If you go ahead and report this kind of thing, I'm going to, you frighten them. That is also under anti-doping rule violation. So these are the 11 anti-doping rule violations which we spoke about. That is not only using the prohibited substance or method, but also these 11 things. So we spoke about presence, use, evasion, whereabout failures, tampering, possession, trafficking, administration to an athlete, complicity, prohibited association, discourage, or retaliate. So any questions, anything, any questions till now you have, please let me know. Akshay, please ask someone from your end.
Yeah. Hi, everyone. If you have any questions, any doubts, any clarifications that you need, you can please ask. You can please ask very freely. Don't hesitate. This is your chance. Ask him and he will guide you. No, sir, I don't think there's any questions as of now. You may please continue.
All right. All right, now we are going to discuss about WADA prohibited list 2022. So this is the single list, which is actually revised every year by WADA. So this is basically done in the month of September every year. And the with effect date comes from 1st of January from the preceding year. That means if it's like the list comes out in 2022, September, it would be with effect from 1st of January 2023. So every year, a new list, that means there this prohibited list comes up, methods and list, it comes up, it's been given by WADA. So there are some medication, some kind of methods which they exclude, some include. Inclusion and exclusion is done by WADA in the month of September to every year, and by it's effective from 1st of January every year. So this year in 2022, the prohibited list, there are different kind of things. One is prohibited at all times, which says substances and method with potential to enhance performance in future competitions or having masking potential. So that is one list is prohibited at all times. That means in competition, out of competition, anytime if you have been caught with these kind of prohibited things or found in your those 11 found in those 11 categories, that would be that means in competition, out of competition, anytime 365 days it has been prohibited. Second is prohibited in competition only. Now substances considered to have a relatively short-lived effect useful during around competition time. Some there is a list in competition list, prohibited list, that means only in during competition, otherwise you can use them, but during the competition if found, that would be under the prohibited, that is only prohibited during the competition, in competition. Now there is a list called prohibited in particular sports. Now there are like beta blockers and all, there are substances or there are medications which are only prohibited in particular sport. It's not all times or in competition, it's basically for the particular sport, like beta blockers in archery or these kind of chess. These kind of things are there where some kind of medications are there which are prohibited in those particular sports. Now it says for substances only useful for doping in very few sports and would negatively affect performance in all others. That means it's whether you take them or not in other sports, it doesn't matter. So, but in particular sport, if you take those kind of medicines, those are prohibited. Now the list says it has got and a coding for substances. It says S0 to S5. Prohibited methods, it says M1 to M3. Similarly, all prohibited lists during the competition, out of competition, all times, if it's a substance, the coding is done S0, S1, S2, S3, S4, S5, and so on. Now, S0 says non-approved substances, S1 says anabolic agents, S2 is peptide hormones, peptide hormones, then S3 is beta-2 agonists, then S4 is hormone and metabolic modulators, then S5 is diuretics and other masking agents. In S2, if you see, it also shows growth factors, related substances, and mimetics. Now, prohibited methods, if you see, in and out of competition, both lists are in and out competition anytime. So that is, if you talk about methods, that is coded with M1, M2, M3. So M1 is manipulation of blood and blood components. M2 is chemical and physical manipulation. M3 is gene doping. Then comes prohibited substances in competition. Those are also, because it's substances, so the code is S6, S7, S8, S9. So S6 comes stimulants, S7 is narcotics, S8 is cannabinoids, S9 is glucocorticosteroids. Now, then comes substance prohibited in particular sports, that is P1, that is beta blockers. Now, these are the prohibited list. Now, this list you can find in WADA's. If you go to WADA website, you'll find the entire prohibited list with the name of medications and all. So you need to be, in case you need that list, you can get it from WADA website, and you'll find the entire prohibited list of prohibited substances in 2022. Now we'll come up with the sample collection process. Now, what is the sample collection process, or how it, this is in competition, how it works. So we'll work about, we are going to talk about this now. So the first thing is there are two types of samples which we collect for dope testing, and those are, one is urine, one is blood. So currently NADA, National Anti-Doping Agency, has got more than 150 trained dope control officers, which are actually located around the all important sports centers across India. So whenever within a short period, whenever required, whenever they need any kind of assistance, or we have to go for any kind of dope testing near to any kind of sports centers or anywhere, so DCOs are available. We have got more than 150 trained DCOs. So they are available around the important sports centers across India. Now, how sometimes we have this kind of thing in our mind, how National Anti-Doping Agency actually, why my name is considered for dope test, why his name is not there, why this person has been selected for dope test, not me. These kind of questions arises in everybody's mind. So basically, I just wanted to let you know about this, that selection of athlete is done on three basic things. One is according to the medal, second is random, and third is target. Now, medal is like in case a person, a team, if the entire team or a person gets the first position, second position, third position, fourth position, fifth, seventh, ninth, any kind of medal category is there. Medal category can be 1, 2, 3, or out of medal category can be 5, 6, 7, any kind of. So understand this, selection of an athlete or doping test can be done anytime and anywhere by National Anti-Doping Agency. This is a ground rule. Without any kind of intimation, NADA has got full access of doing this dope test anytime, anywhere of an athlete. Now, these are the selection criteria are medal, random, and target. Medal, I've already explained you. First position, second position, third position, like that. Random is anyone. Anyone, they can select anyone. It can be fifth position, seventh position, or anyone who, any athlete. They can select the name and they say they can rule out. They can rule out a mission order and say that we want testing to be done for this athlete, and that would be done. Target testing is in case we spoke about athlete biological passport. In case we get any kind of tips, or as we explained that if we come to know about particular person is he is doing some kind of doping and he's not getting caught anytime. So that kind of those people can also come in target testing. So those kind of samples are also being collected. We go ahead and we collect samples for those kind of athletes too. Now we'll talk about the entire process, how it works. First thing, I've already explained you, notification. Notification is when a DCO comes to you, he notifies you that you have been selected for an dope test and you need to come to dope control station. Now, notification says athlete 1 selected for a dope control test is notified by a dope control officer, and a dope control officer will ask athlete to sign the receipt of notification form and agreement to undergo for the test. As explained, that your name, your ID proof, that would be written on that, your date of birth. You need to go ahead and check that. Time would be there that when he notified you. Once you have been notified, you need to sign that document. That is called notification. And then DCO would explain you about athlete may be advised of their rights and responsibilities. We will be talking about the rights and responsibilities too today. So this is the first step for the dope testing, that is notification. DCO goes to the athlete, explains him, shows him his iCard or his authority letter that he has been he's authorized and you have been selected for dope control test. He approaches you, he explains you that you have been selected for dope control test. Yeah, he shows you his own iCard or her own iCard. She will show you, ask you your identity proof. You will show your ID card. He or she will write down your ID card number, time when you have been notified, your date of birth, your name, everything is written, and then they ask you to sign the document. You need to go ahead and sign the document. From the time when you sign it, check the time what is written on the form. From that time to 60 minutes in case you have any kind of medal ceremony, in case you want to go for any kind of media interaction, in case you want to a cool down session, or in case you want any kind of you want to get your ID, or in case you want an interpreter in these kind of scenarios, you get that 60 minutes time. But immediately after, in case you do not have these kind of things lined up, then what you do is DCO will accompany you to the dope control station. The first step is notification, that is done. Then once you go ahead and you report to dope control station, what happens? As soon as you reach the dope control station, it says athletes are required to report to the dope control station as soon as possible after notification. Maximum 15 minutes of out of competition and 60 minutes in competition testing. We will not be talking about out of competition. We'll be talking about in competition only. So 60 minutes time, what I already explained you. Failure to report may result in anti-doping rule violation. As I explained you in the beginning of itself, in those 11 categories, one category is in case you go ahead and you interfere in any kind of thing, or in case you hide from a DCO, if these kind of evasion is there, these kind of thing is there, then it would be considered as anti-doping rule violation. You need to be very, very careful. Now, once you have reported to the dope control station, now comes getting ready to give the sample. Drink water, very, very important over here. You need to understand, yes, we want you to go ahead and give the sample. If it's a urine sample, what is required is in case you are not feeling like to urinate. Now, you know that the basic sample, if it's a basic sample, the 90 ml urine, 90 to 100 ml urine would be required for the testing. Now, in case you are not you feel like you're not you feel like to urine, you want to pass the urine, but you think that you would not be able to pass 90 ml or 100 ml, or in case special test would be there, it would be 130 to 140 ml of urine. In case you feel that I'm not able to go ahead and pass on the urine, I can't, it would be difficult for me to go ahead and pass on 140 ml of urine or 130 ml of urine. So what you do is you go ahead and you go ahead and take, there would be waters and enough of water available. Water bottles would be there. You can drink water, but understand one thing. You drink water, but do not drink too much water. What happens is, once you finish giving the entire sample, and once the sample is sealed, there would be a little amount of urine, which would be which the dope control officer would ask you to leave that in the vessel, in the collection vessel, sample collection vessel. That would be for after the sample is sealed, there is something known as specific gravity. We need to go ahead and check the specific gravity of the urine. If the specific gravity goes down from 1.010, understand it's 1.010. If the specific gravity falls below 1.010, you need to wait in the DCS to give another sample. There would be a resample which would be taken until unless the specific gravity has to be 1.010 or above that. If it falls below 1.010, it would be considered that we are not going to throw that sample, but you need to, again, you have to give the sample, and you might have to wait for 3 hours, 4 hours to get the second sample. That would be, the delay would be from your end, not from our end. So we suggest go ahead and drink water, but do not drink a lot of water. If you drink a lot of water, your specific gravity, I'm guaranteeing you, if you drink a lot of water, if you go ahead and drink 2 bottles of water, 2 liters or 3 bottles of water, definitely your specific gravity will come down. It will come below 1.010. Then you have to wait in the DCS for under observation for another 3-4 hours until unless you won't give a sample which would have the specific gravity of 1.010 or above that. Now, once that is done, so be wise. Once you go to the dope control station, calm down, see if you are feeling like to urinate. If no, yes, take a little bit water. Try to take that, if it's a half liter, try to drink little water. And if you think that you are able to urinate now and you are able to urinate and you are able to, you feel pressure that you would be able to give 130 ml of urine, go ahead and do that. Do not drink a lot of water because it's not required there. Then comes the second, now this is about how the sample is collected. Now comes selection of collection vessel, sample collection vessel. As I explained you that there would be a sample collection vessel that would be sealed in a plastic bag. It's all wrapped and sealed in a plastic bag. DCO would guide you to that to the place, to the counter where you have the sample collection vessel. He will or she will ask you to select one of them. You need to go ahead and select the sample collection vessel. Now it says when athlete is ready to urinate or feel sufficient pressure, may select a sealed or sterile container wrapped individually in a plastic bag. So you select one and you go ahead and start with the sample. Now here, okay. Now once you collect the sample collection vessel, a DCO will accompany you. The DCO would be of the same gender. If you are a female DCO would accompany you to, and if you are a male DCO would accompany you to witness the passing of urine. Now, witness of passing of urine, there is a proper method. Like once you go ahead, once the DCO comes along with you, in case you're wearing a half sleeves t-shirt, that's fine. In case you're wearing a full sleeves t-shirt, you need to fold your sleeves till your elbow. Your top or your t-shirt has to be till your chest, and your lowers or your shorts to be till the knees. So there should be no obstruction in between while you are while DCO is witnessing you about the passing of urine sample. Now it says the DCO who is of the same gender as athlete must witness direct passing out of urine from athlete. Athlete is required to remove any clothing obstruction from the mid chest to knees and from the hands to the elbows, as I explained here. Then comes volume of urine sample. As I already explained you, it's 90 ml is minimum and 120 is maximum. So if on the safer side, instead of 90, make it 100, because you have to keep some urine in the collection sample also for the specific gravity. And sometimes while you are pouring the sample, it can be spilled out. So that's the reason, keep it on the safer side. So you can, in case if 90 ml is required, you can keep 100 or 110 in that. There is no problem with that. Second is, and it's full responsibility of an athlete that he or she is going to handle the entire sample till the sample is sealed. It's athlete's responsibility. A DCO you will only listen to the instructions. DCO is going to give you the instructions. You need to be very careful while listening to the instructions. Do not be in hurry. Listen to the instructions properly. Now, It says that remember that athlete are the only one who handles the sample. Absolutely correct. It's only the athlete who handles the sample. Nobody will touch your sample. It's you who's going to handle sample and until it's sealed and it's packed. Now, selection of doping kit. Once the sample is collected into the collection vessel, you get the sample, you keep it there. DC will ask you, he or she will guide you where to keep the sample. You keep the sample. Now comes the time when you have to select the doping control kit. There you'll find the doping control kit would be in a thermocol box. It would be sealed, packed. So you can choose one of them. You need to check the label. You need to check the box first of all. It's not torn. It's everything is fine. It's packed. So they will ask you to go ahead and choose one. You go ahead and choose the dope control kit. Once that is done, they will ask you to open that. Now need to understand very carefully. These kind of kits, there are two tapes on that. It would be in a plastic cover. You remove the they'll ask you to cut the plastic cover. Once you cut the plastic cover, the entire thermocol box will come out. Now what happens is there are two tapes. One is silver, one is blue. Listen to the instructions before you jump on and you try to remove the tapes. Because once the seal is broken or if something goes wrong, that would be considered as your mistake. Or you are interfering with the process. So listen to the DCO's instructions, what he explains you. If he asks you to remove the blue tape, go ahead and remove the blue one. If he asks you to, when he asks you to remove the silver one, go ahead and remove the silver one. That's how it works. First the silver, then the blue. Do not try to pull the blue one instead of silver or silver instead of the blue one. The entire kit will get spoiled. Now, it says selection of doping control kit. Athlete is asked to select a dope kit consisting of labeled containers, which will hold, identify, and secure urine samples. Again, athletes are responsible for handling their sample until it is sealed. As I already explained you in the previous to this, that it's athlete's responsibility until the sample is sealed. It's athlete's responsibility to handle this sample. You need to be very careful. Please listen to the instructions while you are going, while you are there in the DCS, because anything you do, and in case you do it on your own, that would be considered as interfering the process, evading, and that would be considered as interfering the process, tampering with the sample, and that would comes under anti-doping rule violation. There is a column where the DCO would go ahead and put a remark on that. Even you will have that option that you, in case you have feel any difficulty, there is a column in the dope control form where you can write whatever issues you face during the collection of sample. But similar, even dope control officer has that power to go ahead, in case he finds you doing these kind of things, he will go ahead and write down these kind of observations onto the dope control form. So once you open up the sample, now there would be two bottles. Now those bottles would be labeled as A and B. Both would have some kind of coding on that. Numbers would be there on A and B. So listen to that bottles would be into a plastic cover. You need to remove the cover. Once you remove the cover, you remove the bottles. Now listen to the instruction what DCO is going to explain you. He will ask you to go ahead and pour the sample in bottle B first, and then sample collection bottle 1, that is A. So two bottles would be there, A and B. First you need to pour the sample in bottle B and then in bottle A. There are instances where bottle A has to be filled first and then the B, but in normal circumstances, it's always the B is filled first with 30 ml and 60 ml rest. If it's normal, 30 ml is in B and 60 ml is in A. If it's more than that, then it can be, if it's more than, it's 130 ml with a special thing in that, then it will be 40 and or 50. The way DCO is going to explain you, whatever instructions you listen to him very carefully, and go ahead with the instructions as given to you by the dope control officer. Now, splitting of samples, which we were talking, athlete splits the sample, pour urine himself, unless assistance is required by an athlete. In case you need any kind of assistance, yes, you can ask the dope control officer in case you want any kind of assistance. But this assistance is generally given for people, those who are in case an athlete is under 18, it's if he or she is under the age of 18 years, or if mostly if he's a para-athlete. That means you can say in case he has got any kind of disability. Those kind of athletes are required assistance. Otherwise, other people, I don't think so there any kind of assistance required. It's only the instructions you need to follow and things would be all fine. Athlete, then comes athlete pours the required volume of urine in B bottle, that is 30 ml, and then remaining urine is poured into A bottle, that is 60 ml, as I explained you. So first you need to listen to the instruction, how much ml is required or how much ml is required in B. They will let you know. You pour that kind of, there is markings on the bottle itself. You pour that much in B bottle and remaining in bottle A. Then comes the sealing of sample. Athlete is asked to leave a small amount of urine collection vessel so that DCO can measure the specific gravity of the urine according to the relevant laboratory guidelines. Laboratory guidelines, specific gravity, I've already explained you, that is 1.010. So you need, DCO will ask you to leave a small amount of urine into the collection vessel because specific gravity has to be checked. That is, once the entire bottle is sealed, specific gravity is done after the sample is sealed. Now, before we go ahead in the sealing of sample, there's one important thing. Listen to the instruction of the DCO. What happens is, if you see the sample collection, the sample collection kit, what we use for urine collection is of Berlinger. Now, it's basically what happens is in the bottle A and B, you will find the same kind of code. Only the thing is you will see sample bottle A and bottle B would be written. It will be symbolized like A and B. Now there would be, if you see the caps on that, if you remove the cap, there would be a red, you will see a red ring on the top. Until unless you don't remove the red ring, you cannot lock the bottle. The bottle will not get locked. In by mistake or in some kind of urgency, if you do that, you don't want to listen to the dose control officer. You go ahead and you just go ahead and turn you try to lock the bottle. And by mistake, if that ring gets stuck in between, if the ring is there in trying to lock the bottle, and if the cap of the bottle gets stuck in between, that would be considered as interfering with the sample. That means it would be considered as your mistake. So understand this. Until unless you will not remove those red rings from the bottle, do not try to lock the bottle. Do not try to seal the bottle. You need to remove the red rings. And understand this, do not remove the red ring until unless it's been informed or it's been instructed by the DCO to remove the red ring and now lock the bottle. Once you go ahead and remove the red ring, you go ahead and you lock the bottle, you will find, you will hear there's a click noise. You'll find two click noise, click, click, like these kind of noise will, sound would be there. Once you hear that sound, click sound 2 or 3 times, that means bottle is sealed. You just keep the bottle upside down and see that there is no leakage onto the bottle. Once you see that, you put the bottle back into the plastic bag and put it in the box, thermocol box, and seal it. Now, once everything is done, there is the documentation part comes in. The DCO, this is the DCO would be going, he would be filling up all the forms of whatever numbers are there on the sample collection kit. He will mention that onto the form. You mention your date of birth, that is during the notification itself, your ID number, your name, everything would be mentioned. Now, while filling up the form, he will also ask you some questions, like in case you have taken any kind of medications while within last 7 days or something like that. Whatever you, in case you have a TUE, that means therapeutic use exemption. In case you have some, you can show it to him that I have got a therapeutic use exemption. So he will write down the name of the medication, what is there for the therapeutic use exemption. He will write that down onto the form. He will write any kind of medication if you are using. He will write that also, any kind of supplements you are taking. In case you remember supplement, take a note of the supplement, whatever you're taking, inform them so that they can write down that onto the form. Once everything is done, you will sign the form. 2 copies of the form, that would be 5 and numbers. 2 would be given to you, 3 would be kept. 1 would be sent to the laboratory, 1 would to the 2 to the laboratory, 1 to the NADA. These kind of things are there. The forms are distributed like that. So you would be getting a copy of the form. Now, before documentation, understand one thing: any kind of prescriptions, any kind of supplements, non-prescribed drugs, in case you are taking any, please let the dose control officer know that, so that he can write down onto your form. Now, in case you have a TUE, ask, let him know or her that you have a TUE, show that, so that they can jot down the same TUE onto the form too. Now, while you are signing the document, please go through the document very carefully. Check your name, spellings, your codings on the bottle. In case you have doubts, please clear then and there before signing the document. You need to go. There would be a column where, in case you have any kind of issues, in case your things are fine, you can always write. They'll ask you to write down a remark. You can always write excellent, good, fair, or in case you face any, you felt that this should be like this, you can write down in case you have any kind of issues, or in case you didn't like the entire session, you can write it down. Whatever issues you have, you can jot down that onto the column which is mentioned on the dose control form. Now, this is how the dose control form looks like. On the top, if you see, that's a notification part. If you see here, this is the notification part. Then comes the sample collection. It's urine, blood, these kind of things are written. What kind of sport is there in competition, out of competition. This is where the column is, where you need to sign, where you need to put in case you have any kind of comments. Then your signature is required onto the bottom. Once this is done, they will hand over a copy of the form, whatever you will sign, to you, as well as the sample is packed, sealed, and it's basically the privacy matters. So everything goes into a proper custody, basically chain of custody maintained, and it's basically sent to the WADA laboratory, that is WADA accredited laboratory, that is in New Delhi, that is NDTL, National Dope Testing Laboratory. As I explained you, check information and sign. It says athlete also have the right to put comments on form regarding the conduct of DCO during the dope control session. Be sure to confirm that all the information is correct, including the dope control kit number. As I explained you, athlete receives a copy of dope control form in the end. And that's true. Once you sign, you will be getting a copy. Sending the sample, as I explained you, NADA submits samples to the laboratory located in New Delhi, that is NDTL. So it's WADA accredited laboratory. It's not sent to any other laboratory. It's only to WADA accredited laboratories. It can be to Delhi. It can be anywhere in the world. It can be sent. Then laboratory analysis. This comes once the analysis is done. Once the reports, before the report comes in, it says that the samples are packed for shipping to ensure that the security of the samples is tracked. As I explained you, chain of custody is maintained. The samples are sent to WADA accredited laboratory. The laboratory then analyzes sample A for presence of prohibited substances or methods. Now, sample A, they analyze sample A. Sample B is, they only analyze sample A. If there is a problem with sample A, then sample B is used. That is with the athlete's permission and his signature, and in front of him, the testing is done.
Yes, yes. সঙ্গে ম্যাচ অনেক বাজে ছিল। ওদের সঙ্গে একটা ম্যাচ খেলতে হবে। আরে আজহারকে প্রথমেই একটা
আমার সেকেন্ড টিমের কাছে ওরা 4 গোল।
Akshay. All right. Now we comes to result management. No, I think I thought somebody has got questions, but I think there was some issue.
Okay, fine. So continue.
All right. So now comes the result management part, where after laboratory analytic findings, there can be two things. One is negative, one is positive. If it's negative, it's recorded in NADA records. That is National Anti-Doping Agency's record. And then if it's a positive finding, then it's basically anti-doping. It would be considered as ADRV, anti-doping rule violation. And then the anti-doping disciplinary panel comes into place. Now, once anti-doping disciplinary panel, they actually go ahead and they then athlete has got, in case it's a positive finding, athlete has got some time that where he can say that he can approach for a second test, which is from the bottle sample B, which will be collected, and that's how the procedure goes. He goes ahead with the second sample. The B sample is tested by NTDL, that is National Dope Testing Laboratory, with your permission, with the athlete's permission, with his signature in front of him. athlete is called to the NDTL in case he wants to sit and see how the test is done, or you want to see that everything has to be done in front of you. So then the B sample is opened, and that's how things goes from there on. Now, once the anti-doping rule violation occurs, what happens is there are how the sanctions are being once the athlete it's been considered that it's anti-doping rule violation and the sample was positive, or anti-doping rule violation, 11 out of those 11 categories, any one of the categories being mentioned. So what happens is, if first of all, what happens is as soon as a person runs away from his suppose a DCO is trying to approach you and you try to run away from that field. Once you run away from the field, you think that somebody will collect my medal. I have come first. If I'll run away also, nothing is going to happen. No, negative. It would be considered as ADRB first of all, and you would be disqualified from the result for that particular event first of all. So it says disqualification of result in event during which an anti-doping rule violation occurs. As soon as ADRB occurs, the results of for the particular event gets disqualified. Then imposition of ineligibility for prohibited substances and prohibited method except for specified substances as mentioned. And now comes what kind of sanctions are there. If you go with the first violation, that is for 4 years, and if it's a second violation, then it's 8 years of lifetime ineligibility. Now 4 years, and it says subject to further reduction of 2 years. Now this further reduction of 2 years comes to, in case that's the reason we always ask the athlete, in case you take in case, are you taking any kind of supplements? Do you have any kind of are you taking any kind of medication? If a person says, yes, I'm taking this kind of medication, have you taken any kind of permission? No, I haven't taken, but I required that. I had some kind of flu, or I had a fever 3 days ago. I just took this kind of medicine. You inform them, you write it down. So that means it was not intention. It was not your intention. So your intention was to get rid of that flu or that fever. But what happened is, while testing, that has come into your sample. So if you have already informed that to the DCO, so this period where it says, if your sample is positive, definitely for first violation, it's 4 years. But you have already informed that, yes, you have done that because it was not your intention, but to get rid of flu or that fever or that kind of issue, you have taken it and you have already informed. So for the committee which actually goes ahead and put the sanction, they might consider this, okay, you have already informed that and it's all your intention. So they might reduce that to 2 years. So it's important to do not hide anything from the dope control officer in case you are, in case you are taking any kind of medication or any kind of substitutes or any kind of things. So please, supplements or any kind of things you're taking, please let the DCO know so he can write down or jot down that onto the form. Now, till the sanction for ADRB, is there any questions, anything which you want to ask? Do you have any kind of questions for me? Akshay, please ask them.
Yes, sir.
Please ask them in case they have
Yeah,
any
yeah,
kind of...
I mean, yeah, if anyone, if you have any questions, you can ask it via message, or maybe you can ask.
Yeah, or they can message you, and at the end you can let us know what other questions are there, so you can explain them. So
no, I don't think there is anything here. You can.
All right.
Continue.
So we'll proceed, right?
Yes, sir. Yes, sir.
All right. So now we'll talk about, in case you are taking any kind of medication. Now people sometimes think everything is prohibited. There are so many things they have informed us that is in prohibited list, or methods which are there in prohibited list. So how will we are also human beings? We should be given some kind of upper hand, or some kind of exemption should be there. So for that reason, there is something known as therapeutic use exemption, TUE. Now TUE is a form which is used in case, as you are an athlete, you are a human being, there can be any kind of medical issues you might face in some kind of illness, or there are conditions where you might go ahead and take some particular kind of medication which is there in the prohibited list. In case that is there, so there should be some kind of exemption, right? For that reason, there is something known as therapeutic use exemption. Now, this therapeutic use exemption is in case you are not well and doctor says that you need to go ahead and use these medicines have to be taken by you. In case you will not take it, you will face difficulty in future, or it's life threatening, or there is a problem. You might today your condition is like 10%, tomorrow it might worsen and becomes 40%, and these kind of things may occur onto your body. These kind of things might affect you. This kind of illness can affect your body, so you have to take these medications. But those medications are in the list of prohibited, in the 2022 prohibited list. What you need to do is you need to go to NADA's website, National Anti-Doping Agency's website. There is a therapeutic use exemption form. You need to download that form, take all the reports from the treating physician, take his opinion, take all your diagnostic reports. Everything has to be taken, all kind of medication and all, and you to send it to NADA for therapeutic use exemption committee approval. We'll talk about this. It says athlete may have illness or condition that requires them to take particular medication. Now, if the medication fall under the prohibited list, a therapeutic use exemption may be given, which authorize the athletes to take the needed medicine. Now, there are in case if those medications are there in the prohibited list, definitely you need to ask for a TUE. Once you have the TUE, if you get the sanction for the TUE, they will let you know that yes, it has been sanctioned for how many days and for how many months. If it's for 15 days, 1 month, as soon as, in case it has to be continued, before it gets expired, you need to again apply for a TUE so that it goes to TUEC. Again, they will check. The TUEC is Therapeutic Use Exemption Committee, which consists of, it's a panel of sports doctor, other physicians, all kind of doctors are there, and they actually decide that whether the TUE has to be given or not to be given. Because in case there is an alternate medication for the same kind of thing, then the TUEC has to be given or not. That is decided by the Therapeutic Use Exemption Committee. Now, understand this TUE has to be sent 30 days in advance. This is basically for the advanced medication. That means in case you're planning to take some kind of treatment and you want that medication or that treatment is under all the medication, whatever is there, that is under the prohibited list, then you need to take the TUE in advance. That is 30 days in advance, and 21 days, within 21 days, you get the reply for the same. Now, next comes TUE certification is done by TUEC based on the medical evidences produced before it. The kind of medical evidences you produce, the kind of more stronger is your case file, more chances are there to get your TUE certification. In case you just go ahead and send a note from the doctor that this medication has been prescribed, and you send it to the team, and there is no other reports with that, which actually which is there based on your diagnosis. If there are no reports, nothing else is there, then they might not even issue a TUE certificate, because it's not that means not enough evidence is produced before the medical committee to understand them whether TUE has to be sanctioned or not. So understand, once you download the form, you need to have as much as sufficient evidences to produce that this is the issue, and these are the reports. This is the worsen thing. This is what is going to happen. These are the medication which needs a TUE, and then the TUEC decides and approves the TUE. Now, criteria for granting TUEs is if each of the following conditions is met. It says if the treatment is denied, if treatment is denied, a significant impairment to the health will occur. That means if this will not be given, there would be some issue with the, as I explained you, today your body is you are ill and it's 10% illness is there. Tomorrow, if you will not take this medication, it can increase to 40% or 50%. That means there can be issues with your body. That can be one of the reasons. It should not produce. It should not produce any additional enhancement of performance than the return to normal state of health after treatment. That means the medication which you're going to take will not enhance the performance. After the treatment is over, your body will come down to normal state. It will not give any kind of enhancement to your body. Third is, there is no reasonable therapeutic alternative. As I explained to you, there is no alternative treatment. Then also the criteria, you fulfill the criteria, that is TUE will be granted. Fourth is that use is not a consequence of the prior use without a TUE of a prohibited substance or method. That means sometimes what happens is that you are taking a medication. Now you can think that, oh, now the time has come that I have to go and let's go ahead and take a TUE because I was already taking this medication. Now let's take a TUE for this. If because it's already there in prohibited list. Now the competitions are nearby. So let's go ahead and take a, this is because for that reason, we are going to go ahead and take a TUE because it says that use is not a consequence of the prior use of a prohibited substance or method. That means without a TUE, you are taking something and now you're trying to take a TUE for that. That is not acceptable. Or in case you are taking, you have a TUE, you are taking a medication and suddenly your TUE is expired. Now still you are taking the medication, but again you are applying for TUE for the same medication where the TUE is already expired. So that's what I explained to you. If your TUE is about to get expired, please apply for the fresh TUE before that TUE gets expired. And then you can continue with the medication. Now, next comes, this is basically if the treatment is in advance. Now, you might be having this question, but what else in case something is there in emergency, what I can do? Yes, in case you have any kind of emergency treatment, then also there is a TUE that is called retroactive TUE. We are going to talk about that now. Now, first we'll talk about responsibilities of athletes, roles and responsibilities of athlete. Now, role is that you comply with all anti-doping rules. You comply with that. You are well educated. You are well versed with all the anti-doping rule violations. In case you are well versed with that, that is your role. Once it's there, now comes the responsibility. It says to know. It also says to be knowledgeable of all and comply with all applicable anti-doping policies and rules adopted pursuant to the code. As I explained you, you should be well versed with all kind of anti-doping rule policies and what violates the anti-doping rule violation. Whatever violates it, you need to know that if I do this, this would be a violation. So you need to be knowledgeable and you should comply to that. To be available for sample collection at all times, as I explained you, NADA has got, National Anti-Doping Agency has got full authority to test any athlete, anytime, anywhere, at all times. So you need to be available for sample collection at all times. Now comes to take responsibility in the context of anti-doping for what they ingest and use. It's your body, it's your responsibility to take care of that. Anything, everything, whatever is in your body, it's your responsibility. You cannot blame somebody else. So understand, whatever you are consuming, whatever you are taking in your body, it would be your responsibility. To inform medical personnel or their obligations not to use prohibited substances or prohibited method, and to take responsibility to make sure that any medical treatment received does not violate anti-doping policy and rules adopted pursuant to the code. Whenever you go to a doctor, in case you go to a doctor and you or a physician, any kind of sports physician, and you inform them that before they go ahead and prescribe you the medication, you need to inform them that you are an athlete and it's your responsibility to adhere to WADA code of conduct. That is, you have a prohibited list. So please do not prescribe me any kind of medication which is there in the prohibited list, or any kind of method which is prohibited. Please, in case if that is, in case you are going to prescribe me that, is there a possibility that you can go ahead and you can prescribe me something different instead of if there is an alternate, give me that. In case that is not possible, then we will apply for a TUE. You need to, yeah, that's your responsibility to inform the medical practitioner or medical personnel. Then comes to disclose to their national anti-doping organization and international federation any decision by a non-signatory finding that the athlete committed an anti-doping rule violation within the previous 10 years. That is sometimes there are some kind of questionnaire which comes in where it says, have you been given any kind of sanction? So in case that kind of questionnaire is asked from any kind of from your if it's a international athlete from international federation or national athlete, it could be NADA. So you need to go ahead and in case they ask you to, in case any kind of violation have you done, or you can go ahead and disclose that only to these two organizations, that is National Anti-Doping Organization or International Federation. Next is to cooperate with anti-doping organization investigating anti-doping rule violation. Any kind of ADRV, in case you are they are investigating any kind of anti-doping rule violation, you need to cooperate with the anti-doping organizations. So please go ahead and cooperate in case these kind of things happen. So that is also your responsibility. Now, next is apply for TUE each time whenever the prohibited substance is prescribed. As I explained you, well in advance, in case you go to a physician, and if you go ahead and you ask them that I'm facing this kind of trouble, this kind of issue, illness is there. If they prescribe you some kind of prohibited substance, it's your responsibility to go ahead and apply for a TUE. Now, do not take prohibited substances without TUEC. We have already discussed about that. Do not take any prohibited substance or do not use any kind of method without TUEC is Therapeutic Use Exemption Committee. Now, athletes are responsible for violation of anti-doping rules. So any kind of anti-doping rules are there. Any kind of violation is there of anti-doping rule, athlete is fully responsible for that. Okay. So next comes what we were talking about in case of emergency. That is, in case of emergency, if there is some kind of anti-doping rule violation, or any kind of therapeutic use exemption. What is that? That is retroactive TUE. We are going to discuss about that. This is the TUE process. First of all, that is download a TUE form from the NADA website, certified, duly filled form by treating physician, submitted to NADA. TUEC will decide on your application. Now, the national level athletes will apply to NADA or National Federation, and international will apply to International Federation. As I explained to you that advance 30 days and apply 30 days in advance. This is TUE is for process is for advanced treatment. So you need to apply 30 days in advance before taking that medication. Emergency medication, in case what happens is you are retroactive TUE is for any kind of emergency treatment or acute medical condition whenever it's required. It's basically, suppose we are playing and today while the play is in progress and something happens to me, I faint on the ground. Now what happens is immediately I get medical team evacuates me from the field to the hospital. Or if something goes wrong, immediately I was not fainted, but there's something, some kind of hit occurs onto my, as you people are football players, something occurs on my knee, my ankle gets twisted, I get hurt on my knee or something like that. So now what happens is immediately a treatment is required where the doctor comes in and he actually injects any kind of medication. It can be any kind of Voveron injection, diclofenac, which is not required, which is there in the list of prohibited list of 2022. And now he goes ahead and he injects that. Now this is an emergency case. Now what's going to happen? How the TUE is going to work? Yes, TUE is going to work once you get all right, once things are fine. You need to go ahead and apply immediately. You need to go ahead and take that. You will ask the doctor that whether any kind of medication was prescribed to me, which was there in the prohibited list. And then doctor says, yes, there is these kind of injections were there, which has been we have used these kind of injections, some intravenous or IM, whatever the way they have given you. They will give you the list. You let them know, and they will make a case file. They will make a case file. You go ahead and you apply for a retroactive TUE. Now this retroactive TUE is only for emergency use. That means in case anything happens in emergency, and if DCU try to approach you and there is some kind of emergency which occurred, and later on you apply for retroactive TUE, then the retroactive TUE, your sample would be taken, but the retroactive TUE is also there with that. So it would be considered that, yes, that was an emergency, this happened, and that's the reason your markers are above the level which it should not be, then it will not be go to the sanction, but yes, you will get an approval for that. That is retroactive TUE for that emergency reasons. Now it says emergency treatment or treatment of an acute medical condition was necessary. Due to exceptional circumstances, there was insufficient time or opportunity for an applicant to submit or a TUEC to consider an application prior to doping control. Now this comes in case I'm in the field and after a few days, suppose my games are there after like 10 days. Now today is the day when I was doing my practice and something went wrong. And now I need that medication, and doctor says that you need to have to take this medication. In case you are not going to take it, it will deteriorate your health. So what you're going to do is you will take the prescription of the doctor, you will take everything down, and you will apply for a retroactive TUE because you do not have an ample of time. You do not have that 30 days period in hand. So that is also considered as an emergency. So then you will apply for a retroactive TUE. Athlete is neither a national level or nor international level, still he can apply for a retroactive TUE. Now, this is all we spoke about medication, we spoke about methods, and we spoke about prohibited list. That means there are medications, there is a method and list. But we forget about one thing, that is supplements. Very, very important to understand these supplements. They are not authorized by NADA or WADA. Sometimes you will find on Google that it's there are big stickers, big star marks, and it says approved by WADA or approved by NADA, safe for athletes, these kind of things. You need to be very careful. WADA, NADA never approves any kind of supplements like that. They are all for, it's all a gimmick. It's basically their kind of fake advertisement, what they do. But WADA and NADA they do not approve any kind of supplements like that. Now, there are times when things are there onto the supplements where there are 10 ingredients in the supplement list, and they are from it the names would be different, and onto the prohibited list, the name would be different. So that means same thing will have two different names. On the list, it would be different on the prohibited list, but onto the supplement, the name would be some alternate name, or some kind of different kind of name would be there for that particular supplement or prohibited list item. The name A would be there, but one item has got 3 names. On the supplement, it will be a different name. Or sometimes the name would not be there, but in the supplement you will find that thing also. That ingredient would be there, but it would not be mentioned onto the supplements. Sometimes we go ahead, these kind of things happen. Sometimes during the manufacturing itself, the supplement gets contaminated, the entire batch gets contaminated. Now you don't know, you go ahead and you buy that, you bring it home, but later on you come to know, somebody says that they test it and they come to know that this batch has been tested positive, so cancel this batch, remove this batch from the market. But whatever you have got that from the market to your home, you won't come to know about that, because you're not going to go ahead and read every day about the same supplement that you bought. You keep on eating that, and that batch is contaminated. You are eating that, and it's actually it's against you would be getting positive, because once it's contaminated, definitely it's going to give you an adverse effect for that. So these kind of things. Then there are banned substances in these supplements, so you need to understand that. Now, sometimes with the on the internet also, it's being sold with fake names. Fake things are promised. And then people actually go to Google and they go ahead and check, oh, this is good. They say this is good. Within 2 days, you get this, and it's not, it won't be tested in your blood or in your urine. You go ahead and you take that and you get stuck. So it says there are a lot of risks which are associated with these kind of supplements. So it says, supplements can contain banned substances, make false claims such as approved by WADA or safe for athletes. Then it says, be contaminated with a banned substance during the manufacturing process, exclude some ingredients from their labels. That means some labels which are there, it would be there, but some they are there in the ingredients which are there in the supplement will not be there in the labels. Contain ingredients that they are named differently to how they appear on the list, be sold as fake products over the internet. Now, in case you want to take any kind of supplements, yes, you can always take help of your sports physician, or you need to have go with the thorough checkup for the supplement, whether that supplement is good for your health or not. But no, WADA and NADA will not approve that. Nobody is going to, if even the supplement is good for your health or not good for your health, still, in case that supplement is, if you are being tested positive for that supplement, it would be your responsibility. It will not be somebody else's responsibility. It will be fully your responsibility. So you need to understand that. It says athletes need to ensure that they fully understand the risks. And then comes supplements. They are not batch tested, increase the risk of inadvertent doping. That means in case if it's not batch tested, then definitely it's going to it would be a big risk for it would be considered, when your test would be there, it would be a positive test. Then comes athlete must undertake thorough research before using a supplement. So before taking the supplement, please do a thorough research. Even you have done a thorough research, still you would be responsible in case anything, if you get tested positive for that supplement. So in case in future, in case you're taking any kind of medication or without any prescription or with prescription, please make note of that. If you're taking any kind of supplement, take a small quantity, keep it aside, keep note of the supplement, what supplement you're taking. So whenever you're getting tested, if a DCO asks you, are you taking any kind of medication, please inform them so that they can write down that onto your form and that kind of things. You need to, these are few things which you can do with supplements. You can keep a small quantity preserved somewhere, so that in case in future, if something goes wrong with that supplement, at least you have, then once you get tested positive, you can send it to the laboratory for the test that this is the supplement what I was using. And this was the label. It shows this and this is not there, and how I've been tested positive, that can be done later on. But it would be your responsibility every time. Now, this is what this is all about anti-doping rule violation, the sanctions, how you get TUEs, retroactive TUEs, supplements, we have already spoken about. Now, in case you can always follow us on the on social media too. On Twitter handle, our Twitter handle is Twitter at it's at NADA India Office. Instagram would be at NADA India Office. Facebook with is National Anti-Doping Agency India, and LinkedIn it's National Anti-Doping Agency India. So any questions, Akshay?
Yes, sir. Thank you. Does anyone here has any questions, any queries, clarification? You can please ask Mr. Narendra right now. No one? Okay. I mean, I would like to thank Mr. Narendra Raizada from NADA for giving this insightful presentation and covering all the aspects of doping. I hope he's been able to disseminate this information to all the players and officials who have attended the doping workshop today, and hopefully it'll help you in the future. I would also like to thank Aisha from FSTL for coordinating with us and organizing, helping us organize this workshop. And lastly, if you have any doubts, you can write to us, and we will forward that your clarification or doubts to NADA, and they will clarify it. And one more important thing, I would request all the team managers who attended the workshop today to kindly send an attendance sheet of the players and official who attended the workshop. Please send to us by end of the day. We would need it. Apart from that, if you have any other queries, you can feel free to write to us. Thank you. Thank you, everyone. Thank you, Mr. Narendra.
Thank you, Akshay. Thank you very much. Thank you, everyone. Jai Hind.
Thank you. Thank you, everyone.
Thank you.